20-somethings. Georgia and Emma team up to create a podcast. Have You Tried Yoga?
Hello and welcome to episode 10 of Have You Tried Yoga? Today we are talking about gender and we have a guest, Lionel. Hi Lionel.
Hi everyone.
This is Lionel Scicluna and we also have another guest here today, Fionn Volkov.
Hello.
So we are, talking about gender in and with people with pain.
So Fionn, do you want to tell us a little bit about yourself?
Sure. I am agender. I'm transitioning to be more masculine, though. I was assigned female at birth. My pronouns are they, them.
Awesome. Nice to finally meet you in person.
Yes.
We have spoken on the internet many a time and you've submitted to the podcast before.
Yes.
And Fionn walked in and I was like, finally nice to meet you.
Yeah.
Person I knew on the internet.
Yeah, it was pretty cool.
And Lionel, I know you through Emma. Could you tell us a bit about yourself as well?
Oh, that's right. I am a chronic migraineur, I guess you'd say. So, in short, I was previously a high school teacher of English and history, and the point of the migraine issue developed and worsened to the point where I had to leave teaching. And a kind of indirect way, I ended up in beekeeping as a bit of a occupation at the moment.
That's awesome.
But we can talk more about that later.
Story.
And it actually started as a therapy more than anything.
Wow.
Yeah.
I'm not sure if you guys have already got questions planned on this line, but like...
No, we don't have anything
okay.
planned
So
today.
this is the first podcast. We actually haven't preset questions, so this is going to be very conversational, guys, and we may dilly-dally, but come along for the ride. Like,
Sweet.
let's do it.
Yeah, I'm on. Yep.
We actually want to kind of let our guests really guide today within reason. I think Emma's got some dot points, but other than that, we're kind of like, take the wheel.
Yeah.
And so Lionel represents the cis dude for us today.
For the first time in
Yep,
history.
yep.
For the first time in history, it's like, we need a cis man's opinion.
Yeah. And they're actually really hard to find in the chronic pain community, which is what we want to talk about.
Yeah,
You're
exactly.
you're not privileged for once in your life now.
Yeah, that's right.
How does
Absolutely.
it feel to be oppressed?
Oh, it's been heavy. Yeah.
You're underrepresented, but not necessarily underprivileged as a minority in...
That's right.
particular
Underrepresented for sure.
Yeah,
Absolutely. Yep.
Because it's really weird actually starting to be read as masculine more, because like I realised how little privilege I had as someone when I was presenting femme. But people, even when they're presenting masc only, get far more attention and are taken far more seriously.
That must be
There's-
really weird to experience.
So strange. I don't have to justify myself as much.
As I'm sure I've banged on about many a time, I'm actually doing my thesis in pain, and there's actually lots of evidence proving that female pain is taken less seriously, but on the other hand, men who are in pain are far less likely to seek treatment.
I actually have a few friends who are cis guys who are in pain a lot, and it's really hard to get them to actually go. And
What do you think was the trigger for you, Lionel, to go see a doctor, or was that never an issue for you?
Oh, I couldn't walk.
Yeah, that would spur anyone to a doctor.
Yeah, it was pretty serious. I've got to say that, I had a delay initially. And I think what would happen was it was more about the anxiety of, as in after about the first few episodes, it lasted a week or two. It took a long time for me to be diagnosed as a migraine as such, because there was a complete absence of headache. It was purely neurological. And the headaches are something that actually developed later. So therefore, the actual symptoms prior to that led to a lot of confusion. And I think it was the confusion and the lack of knowing what's going on is what really triggered me to, really start seeking out specialists very quickly.
so my question is, Lionel, do you know what it is that's causing your difficulties? Like, is it physiological issue in like your brain or your...
That is a very interesting one, as I was actually misdiagnosed first up as having a inner ear virus.
Oh.
And that misdiagnosis carried on. It stayed with me for about 4 years. And it was until the symptoms suddenly worsened when I was about 25. So it started around 2020, 21. And at around 25, the symptoms worsened to the point, like I said, where I couldn't walk, couldn't get up. And as I mentioned earlier, there was no actual headache or pain as such at that point. It was just, my vision was blacking out and I couldn't see much. So after another myriad of specialists, I had to cease work because I couldn't get up, basically. And then I was, again, misdiagnosed with Meniere's disease, which led to more complications over the short term. But basically what happened is, and this is what's caused the biggest confusion with my specialists and me psychologically, is that they found a benign brain tumour growing rapidly. At first, when I found that out, I was strangely relieved because
Not
it's
at all strange.
That it wasn't all in your head, like in your
It-
mind.
now it was
Not
literally in my head.
Yeah.
Yeah,
It's
it
funny.
made it real.
It's funny you bring that up because we actually ended up on a rant for 10 minutes straight on one of our episodes that we found out we had an incurable chronic disease and we're like, oh, thank God.
Yeah.
Yep. It is what it is. Yeah, and that relief lasted about 7 days because when I went to see an ENT surgeon to discuss it, he basically said, no, the tumour's not causing it. Yeah, I know. So, and to this day, I've since had radiation on the tumour. The tumour's a vestibular schwannoma, and it grew quite rapidly over the next 5 months, which much, much larger than they expected it to see any growth over a short period, because they're usually a very slow-growing tumour, and the presenting sign is usually deafness.
But you didn't
which
have that. It was affecting
I
your
had
eyes.
the opposite, of very sensitive hearing. So, in response to the whole idea of what the cause is, it turns out that I'm kind of like it's a mixture. So, migraine is hereditary, and my mother's side, there's a lot of migraine in my mother's side, but we're talking classic migraine of your classic aura. A migraine approaches, and then you're in your washout phase, but they're all working and living and functioning. Whereas my first migraine was technically 13 months without an hour's break, so that totally wasted me. And in that time, I had radiation, etc., for the tumour, and of course, the radiation has made no difference to my symptoms, which has proven the hypothesis correct that in fact it may not be the tumour that is triggering a constant migraine state. Yeah, it's basically become my lifestyle, and I guess, and I'm interested to talk further today as well, because it was very hard for me to accept, if for anyone to accept, I suppose, that because prior to these symptoms, I was, a very active martial artist, placed nationally in tournaments, very active, and to then be very limited pretty much within a week, and then to deteriorate from there. So it's a combination of genetics, complete fluke of a vestibular schwannoma being in a brain that's so prone to migraine, and that's really the what we're at with it. And it's been now, I guess, 10 years. 10 years of a migraine issue, but there was a couple of years there, strangely, where there was no problem as such.
I want to have Fionn talk a little bit about their pain and their experience too, but just briefly, we can talk about it more after, Lionel. But for a while, you were finding that beekeeping was a help for you personally with your own migraines.
That's right. Yeah.
So we're kind of family, Lionel and I, and it's really funny that that's all everyone knows about you in our family is that it's like Lionel, he likes bees.
He likes bees.
Yeah,
That's
he's a
right.
beekeeper guy.
Exactly.
Yeah. So tell us a bit about that.
Save the bees.
Exactly. Yeah, that whole run. Now, in short, I got into bees, not as a I was never into bees before I was sick. I'll put it that way. So
when did you start becoming attracted to bees?
Okay, the story goes, I had been off work, so I've been, basically, on sick leave for about 12 months, and obviously going from a very busy high school teacher to a bedridden migraineur has mental implications. So I started gathering pets, and of those pets, we're talking ducks, dogs,
Amazing.
chooks, etc. I ended up getting some reptiles.
So, like, you built a zoo?
Like, it was like a zoo, yeah. It got, and honestly, I got the ducks because they were so loud in the morning. If I didn't get up to feed them, then I'd get complaints. So I started breeding crickets to feed to the bearded dragons, and then I started getting attached to the crickets, unfortunately.
And then you had to feed them to your loud, noisy ducks.
Well, it all just went around in circles. Yeah.
Circle of life, man.
Yeah. In short, I was going with some family up to the ginger factory at Yandina, because ginger, I've always heard, and I think I've heard you mention in a previous podcast too, about ginger possibly anecdotally being good for nausea.
It's
I
legit.
find it very effective.
It's actually a thing, yeah.
Ginger is legit,
Yeah.
mate. I can go from
Ginger ale.
vomity, migraine, and like a sniff of ginger, and I'm still not very well, but I can drive.
It's the difference. Yep.
Yeah.
Absolutely. So that was the thing that got me out of the house, was the
Ginger.
idea of going to a factory where they make something that stops nausea. Because at this point, my biggest problem was I was in constant aura/migraine. So it was nausea, osmophobia, light sensitivity, etc. So by the time I got to the ginger factory, obviously I've always loved honey. I saw a super bee sign and went and did the little, half an hour walk through the beehives they got there. And just looking at those bees and the way she talked about them, it reminded me of me and my crickets and the way I love the crickets. And I thought, well, imagine if I didn't have to feed my pets to another pet. So
to feed the crickets, to feed the ducks? Is this a nursery rhyme?
That would just repeat the cycle. No. I thought, how good would it be that I could have a pet that I didn't have to sacrifice to another pet? So I went and explored.
Wait, do you eat your ducks?
No. Well, not these ones. Yeah, that's right. So I ended up obviously exploring beekeeping, and the main point was I thought it'd just be something to do, to keep my mind busy. But on my first couple of hours at a local field day, hanging around with some bees, I looked at the clock and 2 hours had passed, and I'd stood up the whole time. I had barely even thought about vomiting or falling over or sitting down, and thought there's something so calming and therapeutic about being around these bees. And of course, by the time I got home, I migrained out, and I was out for the rest of the next few days. So I couldn't wait to get back with bees again. And basically, when push come to shove, I started spending a lot more time around bees, and I thought to give it I was getting pretty serious with it. So I thought I started generating a lot of honey. So I had to then obviously apply for an ABN, etc., and start a business called Melita Honey. And the whole point of it was that I was around those bees as my job, which was also my therapy. And in short, I don't know whether there's an advantage of, people reckon there's some calming therapeutic effect just around being with bees. But I've got to be honest that I think a lot of it was to do with the stings.
So the stings were taking you away, like the sensation was taking away.
Distraction therapy of getting stung by bees made me forget about the pain in my head.
Yeah. I know, it sounds ridiculous, but
no,
it's really
but
cool,
it doesn't,
right?
because people do similar-ish things where they'll like use creams that hurt to detract from pain.
Yeah.
Really?
Yeah.
Creams?
Yeah. I was prescribed capsaicin cream, which is like really painful. It's like capsicum spray in a cream.
Yeah. Wow.
Not to not take you seriously, because I think this is incredible, but I just need to make one statement. Your life is the parallel universe of the Beam movie.
Yeah.
You instead of the little bee that falls in love with the human, you're the human that falls in love with just a swarm of bees.
Yep, exactly.
I love it. You should write a book. Please write a book. I
might.
Thank you for sharing that, Lionel. So we might...
Yeah, no worries.
Oh, and we should say, obviously, we've mentioned this before, but both Georgia and I are cis-gendered women, so we're going to represent that viewpoint at some point today. But, Fionn, tell us a little bit about your pain and your story, and then let's go with your story, and then we'll all discuss, like, maybe the worst experiences we've had because of our gender, or our best experiences. So let's kick off with your story, though.
So, mine is pretty complicated. I might start with kind of an overview of what is officially diagnosed and then what I suspect I might have.
Yeah,
sounds fair.
Because,
I
yes,
think everyone listening can relate to that.
I have definitely got post-herpetic neuralgia, which I think I told you guys about in that yeah. I basically had an outbreak of shingles around my vulva for about 3 years, and then only recently was I told that that causes nerve damage, and so now that's actually being treated, which is amazing. I have hypermobile joints. I have deformed wrists, which it's called a Madelung deformity, and it's something that can usually be caught and prevented in childhood, so it becomes an issue when bones start growing in puberty and stuff like that. Basically, there's a ligament that attaches below the growth plate on one of my bones. I think it's the radius. I can't remember the name of the bone. And so
But staring at your wrists like,
Yeah,
it doesn't look
yeah.
deformed.
They look like they're subluxed constantly.
yeah, pretty much, yeah. So
Good spotting.
I can never remember the name of which bone is which, but the outside bone grows essentially normally, but the inside bone, because the ligament which is supposed to attach the top of the bones together, instead attaches below the growth plate on the outside bone. The inside bone gets dragged down and is much harder. It doesn't grow properly, basically. So instead of it being kind of even at the top and kind of like a cradle for my wrist bones, it's more like a cliff with like a dip. And so, yeah, basically my wrists are pretty stuffed up, and I have to wear braces to sleep.
Oh, man.
Or they sublux at best.
Whoa.
And I have to take regular breaks, do regular exercises, because I can't actually do anything to compress my wrists or overtax them. So I was weight training, but just trying to build muscles when I found this out, and I basically can't do anything like push-ups or bench presses or anything like that, which is a pain. So most of my weight training now focuses on my arms and my lower body in general. Anyway, that's an aside. I broke my coccyx a couple of times, the tailbone. It, various reasons, my mother didn't ever take me to doctors, so it grew back, it healed kind of crooked.
Ow.
That can be painful at times, and I have various just kind of headaches and stuff like that. So I suspect that I have Ehlers-Danlos syndrome.
I would.
Yes.
Yeah. Sounds-
George is like, I clock you.
Yeah.
Yeah.
Love it.
Yeah.
Seems pretty reasonable at this point.
Yeah.
Yep.
Yes.
And headaches actually is one of the signs of EDS that nobody talks about.
Yes. I think also that I have Chiari malformation.
Yes, which is highly
Yes.
comorbid or relates strongly
Yes.
with EDS.
Yes. In fact, I got an MRI on. What day is this? Today is Friday, so it would have been Tuesday. I think I got an MRI.
It's funny because Brianna, who has been on the podcast as well,
Mm.
we were talking on a forum about Chiari malformations, and she tagged me and she's like, yeah, so Georgia and I often talk about how we might have it, probably have it, and I think literally anyone with EDS has once sat down and gone, is my spine alignment so bad I get headaches?
Is that what a Chiari malformation
Kinda.
is?
So Chiari malformation is actually a malformation of the cranium. So it's worsened by the fact that our connective tissues are shit. And you might know this. I don't mean to
No, go for it.
over-explain or
Go for it.
No,
Yeah.
explain for me who knows nothing.
Okay, cool. Yeah. So there's what I thought I initially had is
Cervical instability.
which is basically
Who makes up these words?
So cervical is the part of your spine that attaches to your head, which I have cervical instability, which is why I have like a poke chin
same
and I bob when I walk.
those
And instead of actually engaging with physio
You'd be a good
consistently, I have actually taken a break and it has gotten worse. And I'm like, this is fine.
those feels. Yes.
Because physio is terrifyingly exhausting.
and so hard. Yeah.
It's
And especially the cervical cranium stuff.
It's also dollars.
Yes.
Anyway,
Yes, that
I'm
is
being
money I don't
I'm being
have.
rude,
No,
interrupting.
no, it's cool. It's cool.
Continue with your tale.
So because EDS is a connective tissue disorder, there's basically like tendons and ligaments holding the cranium and the cervical spine together. And, in instability, that obviously doesn't work properly. But in Chiari malformation, and I'm pronouncing it that way because that's one of the way that one of my doctors pronounced
There's
it.
like so
Yeah,
many
there's
ways.
like Chiari.
Okay, no one knows.
No, I don't think anybody knows.
It's fine.
This is fine.
Linguistics, I can go on a rant on how words are pronounced. It doesn't matter if you understand it. But anyway, hole that the spinal cord and the ligaments and tendons are supposed to stop the spine from poking into is basically malformed.
Slacks as
here.
well.
Yeah, and so the
Brain
Yeah.
falls down.
cerebellum, that's the bottom part.
So the basal brain, the
Yeah.
cerebellum,
Yeah.
parts of the sulci or the folds of the brain just slip down.
Like,
Like,
That's so
like a
scary.
drain?
yeah, pretty much.
The noises.
Yeah.
Oh,
And and so it can cause paralysis, strokes, all these bad things. But the thing that mainly got me to stop dismissing Chiari as an option is that, so I have, that's right, yeah, I have sleep apnea, obstructive sleep apnea, particularly when I lie on my back, but recently it's been getting worse. So I feel like almost any way I lie, it can be difficult for me to breathe. And I have some kind of dysautonomia, which is dysfunction of the autonomic system.
Represent?
Yeah. Which, among other things, includes heart rate and temperature regulation. People say it's normal, but like I feel palpitations and it's exhausting,
Yeah, it would be.
extra. And slight tangent. I went into Toowong Psychiatric Hospital at the end of 2016, and they every morning took my blood pressure, my heart rate, etc., etc. And like it was consistently above 90 beats per minute,
Grody.
and usually around 100 beats per minute. And like I'd sit there and concentrate and breathe and try to get it down, and I think I got it below 90 like once, but it was consistently. Anyway, so that relates because Chiari causes dysautonomia, causes sleep apnea, causes brain fog, causes headaches. Like I am not totally. I've looked it up a billion times, and so it's somewhere in my head, I'm sure, but I don't fully understand the difference between a migraine and a headache other than severity, which you can explain in a minute.
Tell
Lionel,
us,
because that'd
Lionel,
be
yes.
great.
Lionel.
Because, like, particularly, what do you mean by aura? Because I get light sensitivity, I get noise sensitivity and stuff like that. But I don't know, I feel like the difference is the headache comes from a different place, whereas mine starts from the base of my skull. Like, I can feel it start from there.
when it comes to migraine, is that the headache is just one symptom. So when before I was on my daily prophylactic medications, which took about 6 to 8 months before I had any sort of effect. In short, I had a constant vestibular migraine. So the brain, in its many complicated ways, decides to manifest a migraine state, and that migraine state generally comes out symptomatically in, typically in me anyway, it was in one of three forms. At that first point in time, it was vestibular, which means that my inner ear was not getting the blood supply it required, and therefore it triggered vertigo. So my eyes would flick around in my head, the room would spin, and my eyes would follow the room. Because of the migraine and inflammation associated, would cause it to think that I was moving. And whether or not we want to talk about the brain tumor causing inflammation, which then triggered a migraine state, either way, the idea was that my natural way for it to manifest was through vestibular symptoms. Secondly, the other one that comes through was like sinus. So a lot of people are misdiagnosed as well as what's called sinus headache, thinking that the blocked sinuses is causing a headache to come later. When in a lot of different cases, that is actually the swelling of the sinuses is a symptom of the of the migraine that's going on in the brain. And of course, the third one is headache. So the migraine manifests as technically, and in terms of definition, a one-sided throbbing pain, which is really the third way that the migraine comes out. Now, the whole point is that the manifestation of the migraine is usually one of those three, but preceding that is the aura. So that stage of aura, which for me, before I was on prophylactic medication, the headaches came after the medication started changing me. So imagine that I was on these medications that it basically shifted the manifestation of the vestibular systems into pain, which, to be totally honest, when I get a migraine headache, I have a massive sense of relief as opposed to the vertigo, because you cannot escape the vertigo, whereas I find that quiet, dark place, avoiding loud sounds and stuff like that with the headache definitely helps.
And all I was going to say is, from what I know about migraine too, is that it often is, it can either be, like you said, it can have a headache attached, so pain, but then it can also be obviously sensitivity to other sensory things like light, sound, etc. But then
Absolutely.
also visual aura can be like snow in your vision, not having a lot of vision, or I've had a couple of friends say it's like having snow around their vision, or kind of seeing through like an old TV kind of conking out.
Yeah.
So
I get black spots, big black spots. Yep. So another form of migraine that generally lacks a headache is ocular migraine, where people lose their sight, basically in one or both eyes for the period of what usually would be, leading up to when a headache would manifest. But so my biggest trigger, and that's the point, is that I pretty much all day, every day have flickers of blue light or black spots in my vision. And that's telling me that I'm either not breathing, I'm becoming dehydrated, because I'm always 5 minutes away from crashing. So my life has become about managing that and seeing those signs, as Em said there, about the aura stage.
Share some stories about how we think our gender identities have or haven't impacted. Maybe let's start with doctor stories, or how you've been treated by the medical establishment, because we've all got, there are connections here, but we've all got very different conditions to an extent. Got migraine, tumour, we've got EDS, heart issues, Fionn, heart issues, all the EDS stuff. Then we also share, the vaginismus and things like that. Yeah. And then I've got a bit of pelvic pain and I guess fertility stuff as well. So we're all going at different angles. It'd be really interesting to see if there's anything. Yeah. It's okay.
I was going to say, and the bladder that hates you.
I forgot that I have bladder issues. Yeah, that thing.
Because that's kind of the underlying kind of behaving at the moment thing.
Yeah, that's true.
So you I find, this is a bit of a tangent, but you rank what is actually disabling, and then people are like, but what about this thing? You're like, oh yeah, that's still broken, but it's not as broken as everything else, so I kind of just pretend it's not happening.
# disabled life.
Yeah, and when you have too many symptoms or illnesses, and then you just forget them, like I just did. I just forgot a pretty big chunk of my pain.
Whoops. I totally forgot that I have sleep apnea before.
Yeah, which is kind of huge. Yeah, because you stop breathing. Yeah.
Let's start with how we think generally our gender identity has been treated. We had a poll on our Facebook page. Find us at Have You Tried Yoga Podcast on Facebook.
And Instagram.
The options were, how do you think, the question was, how do you think your gender identity has been, how have you been treated because of your gender identity? And the options were, totally well, I've been respected. And the other one was, no, it was awful, help me. And most people answered, actually nobody answered totally respected, which I think is very interesting. So I'll start with mine, I guess. I might go around the circle and share. Hi, my name's Emma. I think generally I haven't ever noticed like too much discrimination, apart from the fact that I'm a woman and people belittle your pain and think that it's in your head, and that the advice of to basically have a baby, or that you need to consider your fertility, when every person, you know, with these reproductive organs are very different and they want different things, and to give blanket advice is pretty crappy. But I have to say, you know, what has interested me is getting on Instagram with our podcast has made me realize that there are no guys out there. I think we follow maybe 2 dudes who have an Instagram profile that are trying to build a bit of a, cis dudes that are building a bit of a community to say, hey, I have Crohn's too and I'm okay to speak about this stuff. Whereas I think for a long time, you know, women, it's dirty to speak about your period and things like that in Western society, but we do have a community now where it is okay to speak about that. And so looking at the flip side has been very different for me. Yeah. Lionel, so how do you think have being a guy factored into your treatment?
The only thought that I've had is I've had quite a few specialists suspect that I was using illicit drugs.
Oh.
And that was my problem.
That is something I cannot relate to.
Yeah, and I've walked out thinking, and I've walked out thinking, I reckon if I was a woman and I went in there, I would not have been questioned like that.
No.
Yeah, definitely. Yeah. And especially if you were a sporty guy, like they might have gone, what are you using? You know,
get off the roids.
I come in with, you know, curly black hair and, you know, unshaven. And that's the one thing that popped up for me where I thought if I wasn't a guy, I wouldn't have been treated like like I've been abusing drugs. Because the symptoms of migraine make me look pretty washed out most of the time at best. So quite often, there's probably been 3 specialists who have basically brought it up, and one who's asked me outright. You know.
So there's a bit of a stereotype there that a guy who's your age experiencing neurological symptoms would be doing illicit drugs. Yeah,
you know, as in you've been taking LSD or something and you've fried your brain kind of thing.
Yeah, you've set off a
which
trigger.
is completely not like that. Yeah, that's probably the time I've been angry. When I've come out feeling like I've had to justify that I'm sick from within, not sick from any form of abuse or you know, bodily neglect. So that's probably the first thing that comes to my mind when you discuss my gender experience in a doctor's surgery.
Yeah, and I
even think in that case.
Yeah, even if your migraines had been triggered, say, by illicit drug use.
Yep.
Like that info would be important for them, but that wouldn't factor into like how they would cure it so much unless you were a chronic user.
Yeah.
So
exactly. And the point was
there
was one. Don't get me wrong. I've had specialists ask, you know, do you like? It's different when they legitimately ask, are you using recreational or illicit drugs on a form or something? Completely different.
I mean, that happens to everyone.
Yes.
That's right. But when they're saying, well, you know, like, for example, one of the classic comments was, I was furious. Well, you know, when people who take illicit drugs and forms of LSD, etc., they generally end up with fried neurological connections which cause this kind of thing.
God,
and then silence.
Man.
And I was kind of like, and? And I thought, hang on a minute, like I've realised that it was kind of a bit of a leading point there. So, yeah, that's probably my experience in terms of where I've actually thought about, you know, me walking in with my gender may have actually impacted their view or likelihood or me being a certain way. Yeah.
Because I've been asked if I'm taking illicit drugs, but it was more of a, hey, just checking.
Yes.
And no judgment.
That's completely,
no judgment if you are, but I've never been like accused of taking drugs.
That's right. This is kind of like
it sounds like you were cornered.
Yeah. What it's kind of almost the time was, well, what do you expect?
Jeez.
You look like a party, you know,
just assumed.
And that's,
party head or something. Yeah.
And I'm so glad we had you on because I never would have thought that
Ah.
was a thing. And like, I think that kind of,
Oh,
you're
shocking.
positioning a guy who's maybe like, guys are out there, they're doing things. Whereas if a woman's sick, it's either like, it's very frail victimhood kind of thing.
It's
Yeah.
like,
Yeah.
oh, a little old
Maybe.
woman, they get sick all the time because they're women and they're frail.
They're wandering
That's right.
looms.
So
Whereas
it's kind
men
of,
don't get sick,
that's what-
right?
That's what I thought.
So you must have
Yeah.
hurt yourself to get sick because, you you identify as being a man and happen to have a penis.
Yeah.
Yeah. So
Jeez.
you must have made yourself sick. Yeah,
Yeah.
exactly.
That's horrible.
So that's definitely the number one there.
Oh
That's
my
so interesting.
God.
So Georgia, what would you say your experience has
Alrighty,
been?
so as everyone knows, I have Ehlers-Danlos, and
Mm.
before I was on nerve stabilizers, a stable antidepressant, as well as doing an exercise program and kind of setting myself up to thrive, I would get pelvic pain episodes that I would have the legal limit for my age and weight of morphine, and I'd still be screaming. And I had
Wow.
nurses that would stay past their shift to hold my hand because I wanted to die. It was that painful. And, I went in once and they, the first thing they always would jump to, even if I'd been there only days before, is that I had to be pregnant. I had to have an STI. I had to have an internal. I had to be drug seeking because apparently the story goes that women who claim they have abdominal pain, I've been told by a couple of emergency technicians that there's apparently a trend that females with vaguish pelvic pain are seeking morphine. But like the
Oh.
thing is, mate, I was on so much morphine that I was barely awake. I'm still screaming. And
Yeah.
I would get all these, I know that they had to follow procedure, and I know that that was how the book is written, but these decisions to give me internals didn't make sense because I'd seen gynecologists, 2 of them in fact, and I had epitomic ruled out. I was on birth control. I wasn't sexually active at the time, but they would still do a pregnancy test. They would still do an internal, and they would do these things
Yep.
while I was in acute pain, knowing that it would make it worse, and I was at my legal limit of pain relief.
Mm.
And
I
I'm
mean, how can you even give consent then?
well, that's the question. And I'm thankful they treated me. I'm thankful they kept me in ED and watched over me. But I wonder if that, regime of treatment was designed by women who have been there, because I don't think, ethically, I wonder if that's fair. Because, they knew that my vitals were pretty stable, so I wasn't in a life-threatening condition. It's just I had a very severe acute relapse remission, so therefore chronic pain. And because they couldn't find a cause, I was referred to a psychiatrist because I must have a psychiatric illness. And that's
Wow,
fair.
yeah.
That's fair enough.
Hysteria all
That's-
over again.
Yeah, that's fair enough because
Yeah.
there are psychiatric illnesses that cause this pain, which feels very, very real. But I wasn't one of those patients, and the refusal to accept that, no, there's something else here, it's not psychiatric, and they just wouldn't budge. They just would not budge. And it wasn't until I had either my boyfriend in ED with me, my brother in ED with me, or my dad in ED with me that the MDs would believe what was going on. They had to go and vouch for me that, no, this is real, I've seen this before. Because I was a young woman, it would
Yeah.
take my male, companion to go, no, this is legit, hey, believe
How old
her.
were you at this time?
17 years old.
Yeah.
So very, very fragile and vulnerable. And I'm actually thankful I was under 18 because therefore I had the legal right to have a guardian with me. Whereas once you're over 18, you can request it, but they can deny it.
Really?
I understand that's the dealio in emergency ED. So in the public sector, if you're acutely unwell and they need to access you and they need you not to be distracted or to have too many people on the ward, they can strongly suggest you don't have someone with you. But if you're under 18, they have to allow it no matter what because you're under 18. So I'm really thankful that I had those strong male figures in my life to support me because unfortunately I don't know if I would have made it without them.
Yeah.
And
Wow.
I'm so blessed that, my dad and my partner, have been so wonderful and supportive and have never doubted me.
Mm.
Like, I literally had my dad say to me one day in ED when I'm in tears going, no one believes me, they think I'm crazy. He goes, honey, I know you do drama in school, but you're not that great of an actor.
Amazing.
You're not that great of an actor, sweetie, so I believe you. And
that's
and that was, it was what I needed
Yeah.
at that time. So,
reassurance.
But in saying that, I have a female GP who was like, I want to swear right now, but she kind of was like, you know, F that, it's real.
Mm.
And I'm lucky that I've had those powerhouses in my life, because God knows where I'd be without them.
Yeah.
And I think because I identify as a woman and happen to have a vagina, that happened to me.
Yeah,
Controversial opinion.
And I'm
Yeah,
just
yeah.
thinking about that too. I think it's worth noting that I've had some really terrible female GPs.
Oh,
and
yeah.
doctors,
Same.
and I don't.
Yeah.
I think, you know, people often go, oh, I would hate to have a male gynecologist, and I'm
No,
like,
I had no issue with
to
that.
be honest, I have one now, and because it's that certain person, they are good. It has nothing to do with their gender.
I had a male gyno actually do a solid for me and disclude all these crazy wild diagnoses and actually suggest something to me which I don't have, nutcracker syndrome. Well, I have it, but it's not causing my pain. Long story. Not relevant. And he's like, look, this is rare. Nobody would ever suggest that you'd have this, but you're rare, so check it out. And I was like, holy moly,
Well,
okay.
It's like what you said in the EDS episode.
Yeah.
You know, doctors are taught to look for the horses, not the zebras.
Yeah. So, I don't think being a male doctor means that you're going to be a bigot, but, you know, I think it's hard to understand the female internal state sometimes. But just like with Lionel, you know, you telling me your experience, I'm like, I have no concept of what that's like.
Yeah.
Yeah,
Yep.
definitely.
Each
So-
side, yeah.
So, Finn, you were saying earlier, I don't remember if that was on the podcast or not, but you were saying that you're starting to become aware of, like, the male privilege that exists that you never realised before.
That I was kind of intellectually aware of, but not personally aware of.
Yeah,
if that
actually
makes sense.
having, like, a lived experience.
Yeah.
So you've experienced, to a degree, both, well, not both sides, but, you know, a cis woman. No, not cis woman. How am I?
Presenting feminine.
Yeah, yeah.
Fix the way I'm speaking, please.
Yes. So the way I tend, it's different for me because I'm agender, even though I am transitioning medically.
Yes.
But the way I normally talk about it is presenting one way and presenting another way. So when I was presenting femme, so I'm just gonna like add an enormous caveat. I am autistic and I have a lot of trouble kind of perceiving and understanding social cues and stuff like that. And so I'm sure that I've experienced a whole bunch of stuff that I haven't actually picked up on, for example. Yeah.
Perhaps, but not necessarily.
So I have ADHD as well, and so my neurological development, particularly in the prefrontal cortex, which looks after all of the executive functioning, rational stuff, is generally 30 to 40% behind in development people of my rough age and stuff like that. And so I got the neurological development that I find that most people get in their late teens, like between 16 to 19. When I think, I can't remember the actual day, but there was a day when I woke up and, you know how your parents say, you'll understand better when you get older. All of a sudden I understood kind of thing. And so there's definitely a different experience that autistic kids have to autistic adults. But anyway, speaking as someone who was an autistic child.
Yeah, I definitely wouldn't class it as difficult, but I have a nice view. I like my students.
Yeah.
Different.
See, I've only been diagnosed in the last 6 months or so, and so
With ASD.
Wow.
Did you have a moment of like, oh yeah, that makes sense?
First time I had that was when I was diagnosed with ADHD when I was 22, and I was like, wow, so much makes sense about my life now. My childhood was interesting because I had no help. Being an autistic kid, I had so many relationships fall apart because I had no idea what I was doing. And I've always been someone who's tried to be very aware of my behaviour, but kids are only able to do that to a certain extent. So,
yeah, definitely. That's why they're kids.
That's right, exactly.
And like ASD is so underdiagnosed in people who are presenting as female. So
Yeah.
I'm really not surprised it's been recent for you. And it presents in such different ways. So you can probably talk about like being diagnosed and medical
Yes.
treatments from that perspective as well.
The biggest thing, so like my being trans isn't like intricately related to my pain in general, but it also is to a certain extent. So I have premenstrual dysphoria disorder, which basically means that I get PMS, but you know, with the power of 1,000 suns.
That's the one that's like the acronym is PMDD.
PMDD, that's
Yeah.
right, yes. Generally I have, my normal cycle is like 21 days, and it is maybe 2 or 3 days that I have that are really good in the week. In the month, the rest are like brain fog, and it's insane. Anyway, the most infuriating thing I've found in terms of my gender is I went to a service which I'm not going to name.
Please don't, because we could get in trouble.
Yeah,
I was going to be like, no, burn them to the ground.
Yeah,
I mean, burn them to the ground.
Anyway, and it was suggested to me that the only reason I'm trans is because I'm autistic. Autistic people, we are looking for a place to belong, and long story short, I was, Georgia is kind of just putting her face in her hand at the moment, and yes,
I can just see where this is going, and I'm like, oh no.
Yeah, I spent most of my life in the church. I got married when I was 20. I fell into very, very conservative Christianity, and so this doctor's response was, because I didn't find where I belonged in the church, I found it now in the trans community, and so that's why I want to transition, because who doesn't want to be afraid of going to a public bathroom or be constantly aware of how other people are looking at me because I'm afraid of being perceived as not masculine, and that is something that actually delayed me being able to access testosterone for about 3 months.
And so that was like 3 months doesn't sound long, but for people who are transitioning, that's an eternity that you are not yourself.
And so I have major depressive disorder, and various anxiety disorders, including obsessive compulsive disorder, and so I've been suicidal in my life, but on the whole, the last major suicidal period I had was 2016 when I went into a psychiatric hospital, and it's not that I was suicidal that day when he told me that he wanted me to wait for 3 months, but it was a case of the feeling of despair was incredible. I don't really cry. I've never been the kind of person who cries, but I came out from that appointment and I went out to the reception, and she took me to a private room, the receptionist did, because I was so distraught. And so that doesn't relate explicitly to physical pain, but kind of the existential and kind of physical pain because my body is wrong, is huge.
Yeah, and I think it's it doesn't matter that it's not about pain, it's still something to do with your identity and your general
health
well-being.
in general.
Yeah.
And we can say for sure that your mental health absolutely feeds into your physical health and pain.
Yes.
Yeah, and I think, is this right, when we were talking about that crap doctor, is that they were saying that they assumed a lot of people with ASD become trans, or they try that out because they don't know where they belong or they feel different. And to varying degrees, I don't like that ASD is, say, classed as a disability. Yeah, even though, but for the context of, say, talking about this podcast, it's more of a, and it's being neurodivergent.
Yeah. So the way I think about it, because disability is a social thing,
Mm.
as well as a
Yeah, so
physical thing.
I guess I'm
So,
saying
yeah.
it fits
Absolutely.
into the scope of this podcast because it's still within that.
Yeah.
100%.
kind of
Yeah.
thing.
But the implication of being like, you have ASD, therefore you're disabled and
Yes.
you're inept and you're all this and you're that,
Yes.
and it doesn't need to be treated that way.
The most horrifying thing about that day actually is the team leader of that particular department came and chatted to me, and they said that they'd worked with autistic people before, and one thing that they said was that they were jealous at how we were able to turn off our emotions.
Oh my god!
No!
And the thing is that I am someone who is highly emotional and highly empathetic.
That
and
is such a
literally
myth that they're trying to convey and belittle you with.
bit like and
I think a lot of people with pain, or if you've been through really bad medical news over and over again, you don't have an automatic reaction because that's not the worst thing you faced. So
Yeah.
you do
Yeah.
take a day and then it's like, oh, I'm going to crumble now.
Yeah.
So that is actually like such a common, Georgia, speak to the psychology, but that's like the most human reaction you can have. That's like, when people say that when people die and they don't cry straight away, oh, they're not grieving properly. It's like, that's not how humans act.
Yeah,
No.
so with emotions and emotion regulation specifically, it's quite a myth that if you don't portray emotions in a socially normal way, you don't feel them, or you don't feel them enough, therefore you're not a good person. And I actually struggle with this, and it's something I'm trying to come to terms with quite heavily at the moment, and Emma's been a darling about chatting it through with me, but I have a tendency of like shutting down my emotions, because for me to portray them in my head means that I'm not following my gender necessarily, because women are emotional, but if they're too emotional they're irrational, and I'm not an irrational person, therefore I'll have no emotions in front of everyone and I must always be professional. And I kind of explained it like there are some people that can portray normal regular amounts of emotion, there's some people that apparently portray too much, and then there's some people we think are just psychopaths because they shut down and don't show them. But for some people that's seen as they're professional, but other people they're ice cold, and like the way you portray your emotions is so personal, and I actually get a bit jaded up and riled up when people are like, oh, they didn't act this way, therefore X, and it's like, you have no idea what's in their head.
Yeah, and also that a psychopath doesn't shut down their emotions, that they don't have any ability to empathise.
Yep.
So
Yes,
it's
that's right.
It's an incorrect idea about psychopaths to begin with.
Absolutely.
And that's the worst thing about being part of a community that regularly gets called psychopathic, sociopathic, because like I have to be very, very, very careful with the media that I consume, from the news, from fiction, non-fiction, whatever, because if I expose myself to something that's going to make me upset, I actually am very negatively affected for days afterward, because I empathise with the people, fictional or non-fictional, in a way that I can't control. So, for example, I'm not going to watch Infinity War because there's certain things that happen, which, this podcast is coming out like a while. Characters I like have bad things happen to them, and various things like that. And
Dumbledore dies, guys.
I know, right?
So does Yoda.
Yeah.
Darth Vader is Luke's father.
Yeah.
And did you know in Lost that technically they were never lost?
Yeah, it's all a dream, and they all died in the plane, and then it was like a weird afterlife. Yeah.
Is that really the way they resolve that?
Yeah, I know, how awful. I gave up in season 3 because I was like, this is going nowhere.
And Gossip Girl is Dan.
Yeah, which they disprove so many times throughout the whole series, and they're like, no, it was Dan. It's like, that doesn't make sense.
Okay, the only other thing I could think of, and I think we should maybe flip to happy stories. I don't really know. But what I was thinking
Good
of
news week.
is that, oh my gosh. Well, just to finish on like a sad story, the only other thing I can think of is, at the start of like my chronic pain journey, I opted to have, and I totally consented to have, a internal ultrasound.
Ugh.
And the doctor then said, like, I ticked off all the questions and everything, and then and then afterwards he said something like, I sort of said, yeah, like I haven't had sex yet, but I did consent to this procedure. And then the guy was like, oh, I wish you had told me that. Like he was implying that it was bad that my first internal encounter was
oh
not.
my god.
Oh.
And it really, really like devastated me and made me feel dirty. And I remember it's kind of like a blur, but like I called my mom sobbing, being like, am I okay? Should I not have done this? And it's like, yeah, and I was over 18 and I was consenting, fully medically aware, but that really messed me up of this guy thinking that I should have waited, which was dumb, because it's like, yeah, I'm just gonna be in pain. Apart from that, yeah, I would say that I haven't had too many bad experiences apart from the general, do you want kids? And I think because I do want kids and I have made steps to make sure I could try and do that biologically, which was very hard for me at a young age, but I think because I do want children, that hasn't irked me as much as someone who does not want children, and I know that's a really common occurrence. And by the same token, it's not gender, but sexuality wise, I've never really had it hasn't been an issue for me, probably because I don't present as someone who's queer, but it's just not a thing. I think that's been my main kind of experience, is that it's not a thing. It's not really recognised.
On saying that, that's actually kind of perked something with my story, is that it was always assumed that if I had a partner, it was a boyfriend. Every time. Yeah. Every time. And that didn't bother me at the time, and now I look back and I'm like, ooh, what if...
But I think that's pretty low level for a lot of people, where it's just like sharing everyone's stories today. I'm like, yeah,
that's pretty
bother me that much.
Yeah, but still, like.
All right, so let's end on some maybe more positive stories, or what are some things that the pain community could improve upon? What are some things that able-bodied people should be aware of?
I think we need to step away from the idea that it's normal for women to experience pain.
Yes.
We need to accept that a man who presents as a man, if he's had an injury, it's because he's done something gnarly, sick, rad, like jumped off a cliff, or was a tradie who broke his back.
Or did some illicit drugs.
Yep,
I did rehab in kind of inpatient, but I went home at night time. And all the pain patients there was one who was a tradie who broke his spine. Everyone else, it was like they were born that way, they got a disease, or, it wasn't like they had some awesome, rad life story that ended in injury. And, like, in my head, there's this kind of condoning of that, because boys will be boys and girls get pain because God is punishing them for being girls.
Yeah, or, this just, even if it's not religious, just a prevailing idea that women are frail and
weak. Women are weak, that's why they have pain.
But, and I mean, historically, having multiple children in times when disease were rampant throughout history, we were legitimately weaker from all of these really intense bodily experiences.
Never mind the blood loss, the chance of an infection, ratty.
Yeah, that's exactly what I mean. So, like, of course, that's good, but in our modern society, that shouldn't be happening anymore.
No. On a positive note, I feel like slowly but surely, like, even in my own life, Emma and I had a conversation that we're like, we really need to bring men to the table in this situation, because they're actually not being put in this picture. They're not put in the media. Like, you think about Me Before You, a male person with disability.
Oh, the movie.
His. I thought
you were like, Me Before You.
No, Me Before You, the movie.
The movie.
His happy ending as a disabled man was death.
Yeah, and like that's like
why
he was
does
stoic?
Why does a man have to be whole to be a man?
Yeah,
it's the patriarchy, pretty much.
Yeah, and I would say that there's a bit of a stereotype too, that men all have back pain. Can I say?
Yes,
that's such a weird.
I've
stereotype.
heard. Yeah. No, that's something definitely prevails. Like his pain. Oh, it's back pain.
Yeah.
Crohn's is one that kind of comes up, but that's not as kind of he did his spine jumping off a cliff kind of thing. Like,
yeah,
God damn.
Like, oh, your bowel is not good.
Who is it? Hank Green has oh my goodness, now I've forgotten the name of it. It's not Crohn's. It's the it affects,
colitis.
Yeah, ulcerative colitis. And he talks about that for that reason, to educate and to say, look, you're not alone.
Hank Green, the YouTuber, does SciShow and stuff like that.
Part of the Green brothers. John Green is his brother.
John Green.
So one of my besties, who's a man, and he has Crohn's, And for him, I think sometimes I can see the hesitance to be like, this is what's going on with me, but hey, don't treat me like I'm frail and feminine because I have a disability. I mean, that could be very presumptuous of me, but I definitely think a lot of men would relate to that. Like,
I think definitely where the ideal masculinity in our culture right now is to be swole and have muscles and be
climb
very
the cliff,
fit.
be rich, be smart.
What do you think, Lionel?
I would agree. I think with a lot of that, the whole trading with an injury thing, whether they're 40 or 80, whenever you hear about the bad backs or the wrecked shoulders and those kind of things, it's because they work too hard and lifting too much and whatever,
So
and probably
manly.
legitimate when that may well be the case, but the idea that the men who are experiencing pain is because they worked and earned that pain as such. And
It's such an Aussie thing too.
It is.
Absolutely.
And
Yeah. Hard yakka, that kind of thing.
Yeah, hard yakka,
Yep.
mate.
And it's interesting because, like, it also, I feel like, can prevent men from going and actually getting help even after because it's almost, you're expected to just to power through and just get through because, look, I am a man, kind
I'm
of.
a man,
Yeah.
man.
Yeah.
I don't need no doctor with his snake oil and lies.
Yeah.
Yeah. Yep.
Oh,
Absolutely.
God.
Yeah. And that's the big thing that I've had issues with in terms of friends, family, and acquaintances, people I meet, talk to, and of course the medical profession, is that, well, what are you going to do? You're a male, you're 30. How are you going to provide for a family?
Oh, Jesus Christ.
And that's kind of, there's not even a how are you feeling or how are you coping or whatever. It's so what are you going to do next? Oh, if you can't, are you going to go back to teaching? That kind of thing.
I've never had that question of how are you going to provide for your family with your chronic
That's it.
pain? Because I'm a
Well,
woman.
how are you going to? Yeah, exactly. And that's
Jesus.
and honestly, I was a sucker for that for the first couple of years. It put in a tremendous amount of pressure, and I think I was putting that pressure on myself.
I think definitely to go for a career, like being a high functioning, person who has a career like that, like I think that would be very hard to adjust to, going from one way of life to the other.
And then having doctors infer that makes you lesser is awful.
Well, as in, what are you going to do? Was the big. That's just what nearly everyone says, and of course, I already had that existing in my mind. I've got to try and do something because I've got to. It's my responsibility as a young male to provide, build a house, kind of thing.
Yeah.
And I'm starting to slowly accept the reality and my limitations. And even those around me have taken a while to realise that I'm not sick. It's more,
It's
limited, disabled, neurologically disabled, that kind of thing. Which is, and that whole gender role of me having to be the bringing home the bacon, the breadwinner, whatever you want to call it. As I learn to let go of that idea, I feel so much relief within myself. And even when talking to people who are asking, people who haven't talked to me for, say, 10 years, from people from school and whatever, and say, oh, so, what are you up to and how's things going?
Bees.
Yep. Exactly. Yeah, that's right. And that's it. And look, where I'm at this current date and time, in the last 5 months, I've, the whole small business thing that I did there was part of my drive to try and become the breadwinner. But you can't run a small business when I'm this crook, when I'm this. So I have actually I'm winding that back down and basically moving back to bees as being the therapeutic approach.
Yeah.
Because in summary, after all, as great as it all was, the bees are great, but the small business side of things is it's as bad as teaching.
The bees need to pull their own weight, mate.
That's right. Yeah, that's right.
Lazy bees with their honey
exactly
making constantly.
Right. I know. Speed up. I know. So it's
Stay away,
so with all that in mind, it's still, even with that pressure was on me that whole time, that whatever I'm doing my time needs to be enough to not only keep myself going but provide, so
and I think we're only just starting to see it being more accepted that people in relationships with say if you're in a straight relationship, a female being the breadwinner
That's
and things
right.
like that. That's only just starting to really be.
And
Yeah.
still people will turn to the man and go, how do you cope with that?
Yeah.
Yeah.
Yeah. Exactly. Don't you find that hard to? Yeah.
Don't you feel demasculated that she pays for all the bills?
And I think that kind of can come down to a lot of our illnesses not being classed as disabilities and people not maybe like I personally don't go, hey, I'm disabled,
because it feels wrong.
I feel more comfortable saying I have chronic pain and a chronic illness.
Yeah.
But
chronic
people
illness, yep.
still think there's going to be a cure at the end of that.
Yes, because you know it's an illness and illnesses get better.
Yeah.
I thought I would bring up some stats now. This is from 2015. Dr. Susan Evans, who runs the Pelvic Pain Foundation of Australia, is pretty high up there. She wrote an article that said, and I thought this was interesting talking with all of us today, that researchers found the only pain conditions more common in men are cluster headaches, nerve pain after shingles, and I can't say this, this ankylosing spondylitis.
Oh, it's a form of arthritis.
I know what it is, I just can't pronounce it.
No, I can't pronounce it.
Yeah,
but it's where you get like
AS.
masses of like stuff in your
Yeah, and then migraine without perceptual disturbances of light and smell. Everything else, from pelvic pain, irritable bowel syndrome, all other headaches, multiple sclerosis, rheumatoid arthritis, jaw pain, bladder pain, fibro, chronic regional pain syndrome to painful teeth is more common in women. So only the AS one, nerve pain after shingles, cluster headaches, and migraine without the aura are more frequently reported in men. So it's not that we might not be plumbing the depths of who actually has these yet. And then apparently, this is only looking at things from a gender binary point of view. It says that men and women also describe pain differently. Yeah. Research found women tended to use more descriptive graphic language, and men were more likely to express anger or swear, but record the event more objectively. And that can just come down to our socialization, really. But I think that's interesting.
That sounds like such a value judgment on the way that.
Yeah, the word angry is very interesting.
Objective.
No, objective as well.
Why is emotive language not objective, mate?
Yeah.
Not to Emma at the article. That's interesting.
Yeah.
I would love, Lionel, to have you back and Finn as well to maybe talk more about migraine, because that's something, we are having a migraine episode, I'm pretty sure, later in the year. Because I'm meeting more and more people that actually have pelvic pain and migraines, but they're not able to link the two together. And it seems like migraines are actually this big, kind of often comorbid thing to do with a lot of chronic illnesses.
Oh, yeah.
And I was actually reading something that there's a big issue. It was only looking at cis women, unfortunately, but looking at how cis women, the amount of money they lose per work year from taking time off due to chronic migraines, often, premenstrual migraines and things like that, is like a hidden kind of issue within the workplace. So what could we say are some like improvements or some things to be hopeful about when it comes to gender and pain?
Don't assume women are crazy.
Yeah, don't assume women are crazy or that babies fix things, because babies don't fix things.
Oh my God, no.
They maybe fix a desire to have a baby, but that's about it.
I don't know why that's funny.
And it's a bit of a horrifying concept too.
You must put your health on risk for 9 months to deliver a life, and then that may not fix you. And then if you don't love that life,
you have to be chained
awful.
to at least for 18 years, and get no sleep from. So
you must suffer to feel better. What?
Yeah. I would hope that more men are more comfortable talking about their pain.
Yeah, please come to the table and get involved. Like, I feel very strange in saying this, but a lot of people may not agree with me, but I think we need men to be a bit more pushy to get involved in the chronic pain community.
Accurately said.
And I think for cis guys, and Lionel, you can absolutely correct me here, because
please do, because we are not.
Yeah,
that's why we're here. Yep.
That's why you're here.
No, this is what a man thinks.
Mansplaining to men. Whoa.
So I think as men, particularly cis men, you can use your privilege and the assumed Georgia is pointing at me going, yes, right now. Use your privilege to change things better for your own gender as well as for everybody else, kind of thing.
Be an ally.
What
It's
a
like,
wild concept.
I know, right? So, like, in terms of getting more involved in the pain community, I'd say, be pushy, but be pushy about making sure that everybody's voice gets heard, including your own kind of.
So we might wrap it up because I'm just looking at the time and I don't know how I'm going to fit this into a timely podcast because everything we said was good. This
How
is going to be
dare
an
you.
issue. I did want to bring up, we did get a lovely, just before we go, we did get a lovely piece of email. Yeah, that's a word.
Piece of email.
We got a piece of email.
You're a piece of email, mate.
Yeah. We got an email from a lovely listener called Adore, who mentioned she wrote some lovely things about the podcast, and she also mentioned that maybe, we should add some caveats when we've talked about before about how doctors are awful. I forget her exact wording, but she made some good points that perhaps we shouldn't, we should be a little bit more objective and say that there are good doctors out there, and they do know, some of them do know what they're doing, and thank you, Adore, because that was a good kind of check-in to be like, we can respect their opinions. Yeah. So thank you, and if you would like to send any more piece of emails to us, you can do so at haveyoutradyoga@gmail.com. No, it's at hotmail. haveyoutradyoga@hotmail.com. So thank you, Lionel and Fionn, for joining us today. Where can people find if they want to find you on social media, if you want them to find you? Do you have anything to plug, basically?
Do you want to plug things?
Do you want to plug your honey, Lionel?
Oh, if you like, you could check out Melita Honey. Yep.
How do you spell Melita?
Malita.
Yep.
Honey.
We'll
Melita Honey.
stick
Yep.
it up
It
on
just
the
it
website.
just means honey.
Bees.
I love
Yeah.
it. It's like chai tea, it's TT.
Yes.
That's funny. And Finn, what
Yeah.
about you?
I mean, I have various social medias. If you like to watch me complain and retweet things about politics, you can follow me on Twitter at Propter Veritas, which is,
Can you spell that?
yes, it's Latin, PROPTERITAS. It's Latin for the sake of truth.
Oh, I like it. And we'll link to them.
Yes.
We'll link to them. Gosh,
So you
my
can-
English is excellent.
So you can do a click on a piece of email.
Yeah.
Oh, if you guys want to follow my transition as well, I'm on Instagram as, I believe, Propter Veritas as well. But you can find me as Finn Volkov.
Lovely. Well, thanks for the chat today, guys. It was really
Yeah, great. Thanks for having me.
No,
It's great
thank
to meet you all.
you. Thank you
Yep.
guys.
Thank
You
you,
guys
Finn.
made this episode happen. Thank you.
And I don't remember what our next episode will be. Do you? Oh no, yes I do. It's my favourite episode, which is
Munchausen's by internet.
yes, we're going to be talking about people who fake being chronically ill online. It's called Munchausen by internet. It's an amazing phenomenon that I exotify to the extreme because I find it so fascinating. Because why would you do that? Why would you want this?
Financial gain, sympathy,
Yeah.
Anyways,
psychiatric illness.
so if you have experienced, if you've experienced anyone conning you by Munchausen by internet, if you have experienced it yourself, you went through a period of doing that, please let us know. We would love
We
to
will
hear
be
your stories.
respectful. I promise.
Georgia will be respectful.
Just email us. We want stories about this phenomenon. I don't care if it was your mum's uncle's donkey. Email us.
Yes. All right, and that's it. So thanks everybody. We can all say bye.
Ready?
Bye-bye.
One,
Oh.
2, 3.
Bye.
Bye.
Bye-bye.